Hello again, students. Hello, Professor Zeeb here. And this time what we're going to talk about is some of the physical development of late adulthood. Remember, late adulthood is approximately 65 and up is the age frame we're sort of going to focus on here. And so what I want to start off with is just looking at some of the sensory declines of late adulthood. Okay, so once again, we go to the physical development in late adulthood. And we are going to transition over to some of the slides here. So next we go to sensory abilities, going to be the main focus of this mini lecture here. A lot of these sort of issues are going to be continuation of problems that we experienced earlier in middle adulthood. Okay, but we're going to kind of continue and add some new ones here and talk about them. So let's start off with vision. Okay, so some of the difficulties related to vision with late adulthood would be things like farsightedness, which we've mentioned before. Remember, this is where you can't focus on nearby objects like your cell phone or reading kind of thing, but you may still have the ability to see things far away. Okay, remember we said that this typically sort of becomes a factor around age 40, but certainly would continue into late adulthood. And we said that some of the problems here is that the lens, the focusing part of the eye, becomes thicker or less elastic and results in some of these problems, all right? We're also gonna find that as you get older, more illumination is required to perceive stimuli, and that increases as you get older in terms of age. In terms of our retina is the structure in the eye that helps to detect light. It contains the sensory receptor cells that detect light waves. Typically, those changes really don't happen before 60. Of course, they could, but we would expect it to be after 60. Some other visual issues here, floaters, okay? Some of you may have experienced these before. So floaters are like these floating spots in your visual field. Technically, they're particles suspended in the jellied substance of the eyeball. And to me, when I experience them, they look like little cells. They're almost like little transparent particles that float around in your visual field. And typically, they're not a big deal. It's not like it creates problems for you to see in most cases. To me, they're just more annoying than anything. And I personally experience them in bright environments. So like when I'm driving during the day, it's a very bright day, I'll see them through the windshield, basically in my visual field. So just sort of an annoying thing. Typically don't create much of a problem, but the point is that they're more likely to happen as we get older. All right, dry eye, another issue that's more likely with age. So this is caused by a reduction in the tear glands or tear production. This is typically an easy fix. So fluid or eye drops can be added to alleviate some of these problems. Okay, so that one's just a real easy fix. However, this next one is more dramatic in terms of more problematic, I should say it that way, and that's age-related macular degeneration. Typically, the person is 50 or older when this happens. And so what happens here is that the layers in the retina may become ruptured. So there's little tiny blood vessels in our eye, and these may actually become ruptured, which creates some problems. And most likely the problem is that it's going to cause faded, distorted, and blurred central vision. So in other words, when you're looking at something straight on in your visual field, that's typically what would be affected. So to kind of show you what I mean, it would look something like this, where the central portion of your visual field may be blurred or faded or something like that. 1 in 6 of these cases are 75 or older in terms of age. So we know it really hits the older population more. And the good news is that laser surgery can help to prevent this or fix this, okay? So a lot of these problems we're gonna talk about can be treated, so that's the good news. Some of our risk factors for getting this problem would include being a smoker, so smokers are more likely to have this problem, having a family history of it, so in other words, you've had several relatives who have dealt with this issue, so we see a familial pattern. And then lastly, being Caucasian is another risk factor. So we see some higher rates in the Caucasian population. All right, next we go to cataracts. You know, this is something that you may see in your animals. Like I have an older dog that has this problem. So an easy way to explain this is that it's like a clouding of the lens in the eye. In other words, it would look something like this. Imagine trying to see through this here. So we think that proteins in the eye actually start to clump together and create this sort of clouding effect, where when you're trying to look through that, it creates, you know, problems seeing. And so, believe it or not, guys, cataracts are the leading cause of blindness in people over 65. So we know it, once again, it's more likely as you get older. The good news, once again, with this is that they can be removed through laser surgery. In fact, I have several relatives that have gone through this, and they've told me that after the procedure, it's kind of like now they can finally see. You know, it's like they look in the mirror and they actually see themselves for the first time, possibly in a long time. So this one can be alleviated with laser surgery, okay? So another common problem as we get older, let's move on. Next we go to glaucoma, okay? Glaucoma can happen at different ages, obviously. And so this is caused by increased pressure within the eye due to fluid buildup. Apparently our eye has like a plumbing system, and sometimes problems with the plumbing system occur, and so it leads to pressure of this fluid buildup, which actually can damage the optic nerve in the eye, creating problems, and so it can actually lead to blindness. So this one is, of course, treated with things like eye drops, pills, surgery, and of course the very controversial treatment marijuana is used for glaucoma as well. So there are treatments available for this one. Depth perception can be a problem as well as we get older. So it may be hard to distinguish between close and far objects. So to me, an example of this would be trying to park your car and trying to judge distance, like in a parallel parking situation would be a great example of that, or it may be more difficult to do that. It may be more difficult to discern different depths. So that can be problematic. Psychologically, this also requires adjustment. So think about how this person would feel, or they're having to deal with all these changes, potentially losing part of, you know, your vision, or having problems with your vision. Psychologically has to hit us hard because we rely on vision so much to survive and to navigate and just live life. So this is one of those senses that we really see you know, pretty significant psychological adjustment because we depend on it so much. So it could be associated with things like depression, you know, stressing out that you can't see like you once could, low self-esteem, that kind of thing. So we know it's often related to those kind of issues, unfortunately. The great news, however, is that, remember, most of these problems have treatments or ways of getting around them. So that, you know, if you go through that treatment and knowing that that treatment's available, can lessen some of these problems that we just mentioned in terms of the psychological reaction to it. Okay, so next we go to hearing. All right, so 63% of 70-year-olds show hearing loss. So remember, we said this starts around 40, but really can sort of worsen as we get older. What's interesting about hearing when we compare it to vision, this one is not pursued as much in terms of getting it fixed. Obviously, people do that, but it seems like when our eyes go wrong, we immediately go to the doctor and get that fixed and get glasses and things like that. But it's amazing how many people suffer from hearing loss and continue to live life without doing anything about it. So I know people in my own life that have shown that, where they've let it go. I mean, they've gotten glasses pretty quickly because you need those, obviously, to survive. But hearing, we can kind of get by without it. So psychologically, it's not one of those really, you know, power punch things where it really affects us in the same way. The major problem with this one is that it may create problems understanding human speech, especially when background noise is present. So that seems to be where it's a major factor, is because our ears are just not as effective as filtering out background noise as when we were young. And so once again, we've kind of talked about this before, but it may sort of depersonalize you because you can't follow conversation. You may be sitting at a table with people at a restaurant, there's background noise, and it may be difficult for that person to actually follow the conversation. So it kind of takes a little bit out of you as a person because you can't participate. You can't follow the conversation in the same way you used to be able to do. So we think that distracting noises inhibits the processing of speech, and older adults have more trouble doing this, unfortunately. All right, next we go to smell. Remember, smell tends to hit us hard, the loss in smell, more so when we're older. And so we think that there's an atrophy of the olfactory fibers in the nose. Once again, this one's going to hit us a little bit later. 70, 80 is where we really see those big effects. But unfortunately, this can create problems because, being able to smell is a human experience that possibly could be lost or affected. Same thing with taste. We do see a decline in tasting ability. And so just to kind of give you an average of how this can be affected, young adults have an average of about 250 taste buds on average. Older adults, by the time we get to this stage, it's no more than 100. So our ability to taste things can be affected. And so this can be a problem because a lot of times when we can't taste something, we add salt or seasoning to it. And sometimes those things can be bad for our health. So you have to kind of think about that, guys, is that as you get older, your ability to taste things is going to change. And so you have to be careful about adding harmful substances to our food. So it's just something to kind of think about. All right, next we go to touch and pain. We're going to see a decline in touch sensitivity as we get older. So 70%, according to research, of older adults report a decline in touch sensitivity, which in most cases is not a big deal. Does not seem to be a huge issue for people compared to, say, things like vision, as we said before. An estimated of 60 to 75% of older adults report at least some persistent pain. Usually it's involving our back or our joints with arthritis, for example, or our hands and feet hurt. So that's kind of troubling, is that, you're living everyday life in persistent pain. It turns out that women report more pain than men, if we look at the research and so forth. And furthermore, older adults are less sensitive to pain, but they may be less pain tolerant. So I thought that was kind of interesting. So even though they may not be able to feel it in the same way, because it's probably more prevalent, it becomes a major issue in terms of living your everyday life. So that may create less tolerant. In other words, you're more likely to complain of it and, just unable to sort of deal with it is kind of what that's saying to me. All right, next we go to cardiovascular system and lung issues. Cardiovascular diseases and disorders increase in late adulthood, and quite frankly should be checked regularly for that fact. These can lead to things, of course, like heart attacks, which are very serious, stroke, and kidney disease, all of those very, very serious conditions. So it's very important for, as you get older, to get regular checkups to catch those early, which can help the prognosis of those. Our lung capacity does drop 40% between the ages of 20 to 80, even if you don't have any type of disease. So that's a pretty significant drop. And so what the research is showing is that it can be improved with diaphragm strengthening exercises. So there's training and exercises that you can employ to help prevent some of these problems. So that's something to kind of keep in mind as a human, especially if you like to be very active, and obviously a lot of us do as we get older, to continue that activity. All right, and then we're going to conclude here with sleep. Approximately 50% of older adults complain of the difficulty sleeping. Remember, this is more older adults. This includes things about like trouble falling asleep, or maybe you've woken up and you can't go back to sleep. We know that older adults report more awakenings during the night. So wow, we know it's pretty significant enough to see a difference between older adulthood and say younger ages. The problem with this is that poor sleep is related to so many problems. So it's a risk factor for falling, obesity, lower cognitive functioning, which is kind of surprising, health problems, and even earlier death, according to research. So a lot of hardcore, big time factors there linked to lack of sleep or not sleeping appropriately. So there are some studies that are showing that exercise can help with these things. So the studies seem to be focusing around older men. So they found that regular aerobic exercise in older men can help problems with sleep. In other words, men who go through these trainings and participate in regular aerobic exercise do not report the same amount of sleep problems compared to those who do not. So I thought that was kind of encouraging. So once again, it's just showing the many benefits of exercising, which is once again a common theme in the course here. All right, so this will conclude our short lecture on some of the physical development of late adulthood. Please continue in the next step in the class.